bilateral anterior thoracotomy or clamshell thoracotomy. A clamshell thoracotomy is primarily treating pericardial tamponade as a potential cause of death. The goals are to release cardiac tamponade, control hemorrhage, and restart the heart. Still, the survival rate for this procedure remains less than 10%. The main indication is a cardiac arrest with loss of output less than 10 minutes before arrival and penetrating trauma to the chest. The indications in blunt trauma are still debatable. You will need a scalpel, trauma shears, artery forceps, skin stapler, rib spreader or retractors, and a jiggly saw. Identify the sternal notch, the angle of Louis, and the second rib on each side. Count down to the fifth rib bilaterally and aim to cross the sternum above or on the superior border of the fifth rib in the fourth intercostal space. This will avoid the neurovascular bundles. The patient is positioned supine with abducted arms and extended to 90 degrees. A curvilinear bilateral submammary incision is made, extending from one mid-axillary line to the opposite across the anterior aspect of the chest. Remember to follow the contour of the ribs. Female patients should have their breasts retracted superiorly to expose the area. Incise the skin, subcutaneous tissue, and muscle with a single incision. Then use your shears to cut all layers of intercostal muscles, protecting the underlying lungs with your fingers and avoiding cutting across the ribs. Divide the sternum or xiphisternum with scissors or the jiggly saw. Use 1 or 2 rib spreaders at each side of the wound. Identify the structures and make a 10 cm anterior midline longitudinal incision in an inverted T fashion using scissors, avoiding the phrenic nerves that run laterally in the pericardium. Remove any blood clots from the pericardium, inspect the heart carefully for any lacerations, and use digital occlusion if needed, or apply skin staples to the wound if any found. Communicate to your team your findings, the wound size, position, and if the heart's empty or full. Consider internal cardiac massage with 2 hands if necessary. The patient needs to be transferred to an operating theater if there is return of circulation and the bleeding has been stabilized enough.